My name is Alexandra. I'll be presenting on complementary alternative integrative medicine. At the end of this presentation, the learner will be able to do the following: explain the differences between the three terms, understand how complementary alternative medicine influences nursing practice, healthcare, and society, and identify ways to help overcome the issues CAM presents. According to the National Center for Complementary and Integrative Health, or NCCIH, when describing these approaches, people often use alternative and complementary interchangeably, but the two refer to different concepts. Complementary is non-mainstream practices plus conventional medicine, whereas alternative is non-mainstream practice in the place of conventional medicine. And true alternative medicine is uncommon because most people use non-mainstream approaches with conventional treatment. So what is integrative medicine? There are many definitions of integrative medicine, but all involve combining conventional medicine and complementary practices together in a coordinated way. Most complementary practices fall into two categories: natural products and mind and body practices. A 2012 National Health Interview survey stated the top 3 national products used are fish oil, glucosamine, and probiotics. Mind and body practices, yoga ranked top. So what is the relevance and why should we care? Nearly 1/3 of the US adult population uses CAM therapy. And these are diseases or conditions for which CAM is most frequently used. So just think about the many patients we care for on a daily basis that complain of back, neck, or joint pain. We should be considering the possibility of CAM therapy for these patients and the potential benefits or risks associated with its use. There are gaps that exist regarding nurses' baseline knowledge about CAM therapy, beliefs of efficacy, and learning needs for further education to facilitate the integration of CAM into nursing practice. And these deficits present a concern because as nurses, we can't advocate for CAM therapy or even understand our patients' use of these treatments unless we ourselves are educated. Since early 2000, we have seen a surge in the use of CAM. People are influenced by friends, family, culture, advertising. They're influenced by lack of insurance, by high out-of-pocket costs for medication, and many just want an increased sense of control over their health. But whatever the reason they're using CAM, it is likely that you will care for a patient who is practicing or is at least interested in practicing CAM. A patient may ask you, "What do you think about this herb I found on the internet?" You want to be prepared to answer this question. Many people make decisions without accurate knowledge or professional input, and it may result in ineffective or even harmful consequences. The most intentional way we can start implementing CAM into our nursing practice is during medication reconciliation. So ask about CAM use, find out what they know or what they think they know about the medications and supplements they are taking, and always look at their medications and identify possible interactions. CAM also influences how we structure our patient education. We must remain curious and aware of the potential dangers of CAM therapy. So help your patients make informed choices. Evaluate their understanding regarding the difference between over-the-counter drugs and supplements. And also caution patients about fraudulent advertising and that not everything is as it seems on the internet or commercials. Lastly, encourage our patients to fully disclose CAM use to their healthcare providers. Let's discuss the negative impacts first, starting with non-disclosure. 72% of patients do not disclose CAM practices to their primary care physician. One of the main issues and reasons for the non-disclosure is communication barrier. There's controversial debate about the clinical efficacy of CAM use. There's limited scientific data, and there are variations in the knowledge level and appreciation of the existing evidence about CAM. Moving on to positive impacts, a study surveying over 11,000 patients in an integrative health clinic reported the following positive responses. There's an overall emphasis on promotion of health, self-care, and well-being, which the US needs considering the high rate of chronic illnesses. Many prescription or over-the-counter medications negatively interact with herbal supplements, such as St. John's wort can cause decreased effectiveness. They may also cause increased bleeding, so be careful if you're going to have surgery. And there's many supplements that haven't been tested on pregnancy or breastfeeding mothers. So I guess the take-home message here is just be cautious of the word natural, because it does not always mean that it's safe. For example, licorice root is very common, but it can cause serious harm to the liver. So in summary, having the knowledge and understanding about what is safe and effective presents challenges for practitioners and patients everywhere. If you or someone you know wishes to practice complementary and alternative medicine, it is important to acquire professional input from nurses or practitioners. Integrative medicine has been proven to lead to increased patient satisfaction and improved outcomes in a safe environment. Thank you.